G'day, it's Eric Backer, New Zealand naturopath and author of Candida Crusher. Thanks for checking out my video today. I've got a question today from a lady in New York. Eric, what is a latent intracellular yeast infection? I've been reading a page on it on the internet and would like to know your take on it. Well, I just had a look at a page by a lady, Dr. Marjorie Crandall, actually PhD, on latent intracellular yeast infection. This is something I've known about for probably 15 years plus. And Dr. Crandall says here basically it's a low-grade yeast infection that's not very active. It's also termed chronic atrophic erythematous candidiasis. So atrophic means not feeding, it's not really growing, and the erythematous means red. So redness, probably burning, stinging, pain, not growing. It sounds a little bit like vulvodynia, or a condition I see a lot with women where they'll get, an area of the vulva red and inflamed. It's not active yeast, but what happens is the yeast will often go into the epithelial, deeper into the tissues. They'll stop growing, but they'll keep producing enzymes and also Candida byproducts like toxic metabolic byproducts. And this can create infection and inflammation on a deeper level, and it can often create pain like burning, stinging. This is a typical pain that many women experience around the vulva region, a term called vulvodynia, pain around this area. So it's latent, so it's not very active. But what I'm not really happy with what Dr. Crandall proposes is long-term use of some kind of a medical antifungal drug, probably fluconazole, probably for 6 or 12 months, and also continual use of topical hydrocortisone. I think this is not a very good treatment, Dr. Crandall, because giving patient long-term antifungals and topical steroids. Steroids are really bad to use long-term with patients. They create adrenal suppression. They weaken the adrenal and the stress axis. They make the person more prone to infection down the track. They weaken the immune system. They weaken the skin tissue. Long-term fluconazole is proven not to be effective. It doesn't target any bacteria or parasites, purely Candida. It's not a good idea. You're weakening the immune system. The typical fluconazole resistance has been reported in the literature now for many years. So giving any drug or supplement, for 12 months non-stop is a crazy idea. So I've often said treating, going into battle with guns and bombs and bullets and that, it's just not really going to work. You're just basically upscaling. You're just creating more hostility and counterattacks is a good word to use. So you can't fight Candida with guns or bombs. You just can't keep dropping drugs on these people all the time. It's not the way to do it. So what's the solution when we've got this latent intracellular yeast infection? Well, the first thing I'd probably do is get the patient to make some serious lifestyle changes. Now, Dr. Crandall, in her defense, did mention some lifestyle changes, but fortunately the first 3 or 4 things on the page were all about drugs. So lifestyle changes are the key thing to do with these patients. I've successfully helped hundreds of cases of vulvodynia of women get rid of this condition, many times by looking at them very carefully, understanding that many of these women have got high levels of anxiety and depression. They get relationship problems. I know all this. I've seen it before. Many of them are working mums with a few children. They're at high stress. They've got poor sex lives. They've got a lot of pain, irritability, and they really are sick and tired of feeling like this. They're sick and tired of going to the doctors and getting repeated drugs and no real results. These women often need a significant lifestyle change. I'll get them to cease all alcohol, all sweet foods, all chocolates. And then a woman might be watching this and saying, done it, it's not working, been there, done that. Okay, what you probably haven't done is made some other changes. You've got to learn to say no to people. You've got to learn to relax more. You've got to take time out, because all this high stress and anxiety is only affecting your immune system, further and further. It's just pushing it back. It's making it harder for you to recover from this latent problem. While I don't doubt that a latent yeast infection does exist, I do believe that it is curative, like any condition in the body. If the patient starts getting their lifestyle and diet balanced and on track, take some antifungal natural products, they can get themselves back on track, usually within 6 to 9 months. What do you use in the vulvic area for pain and burning? Aloe vera, pure aloe vera gel is beautiful to use on the area. Abstaining from sex is often a good idea. And treating the area as well. Make sure, absolutely sure, that there's no vaginal yeast infection or thrush going on. And follow my 2-stage treatment you'll read on yeastinfection.org. Many women with vulvodynia do have some kind of thrush or latent thrush, particularly around the cervix region deep inside. It's easy there to have a little bit of thrush that goes undetected. Particularly if around ovulation or before period, you notice a lot more pain and irritation. The other thing I'm going to recommend that you do with these latent infections, if it involves the vulva, is to make sure you get your progesterone, estrogen, and testosterone balanced. So get the hormones balanced properly. All right. You may need to do some saliva testing with your functional medicine doctor and make sure that you haven't got too much testosterone going on there or lack of progesterone. These things can really impair the tissue in and around that area. So hormone testing is very important too. Saliva testing is the way to go. Diet changes. Go to yeastinfection.org and read about my Candida Crusher diet. Get my Candida Crusher book. Chapter 5 explains a lot about vaginal treatment. But please abstain from taking long-term steroids on the sensitive skin around there. And think twice about taking fluconazole. Have a think about Candida, a product I developed up that you'll find on candida.com. It's probably the world's best Candida antifungal at this point in time. It's not going to give any resistance. It's going to be highly effective against a wide range of Candida and pathogens, and it's not going to create any side effects. So I hope that answers your question about the latent yeast infection. Okay, it is a real phenomenon, but it is curative with the right kind of natural approach. Thanks for tuning in.